Health insurance giant Anthem announced Friday it will buy rival Cigna for more than $54 billion. Now, this comes just weeks after Aetna and Humana announced their plans to consolidate, potentially cutting the big five health insurance companies down to the big three, depending on what regulators decide. Here to explain what this means for insurance customers, CBS News business analyst Jill Schlesinger. Jill, what is going on here?
Well, these deals have obviously been in the works for a long time, but they came to fruition after the Supreme Court ruled favorably on the Affordable Care Act. Now, remember, the new law puts limits on the amount of premium a health insurance company can charge. That means under the new circumstances, the companies have to do three things. They've got to scale up, reduce their costs, and they've got to actually figure out how to bring more customers under their umbrella.
A lot of consumers right now are wondering, so what does this mean to me?
Well, according to the companies, the health insurance companies, they say these costs are actually going to be wringing out of the system. It's what the law intended to do. The companies will have better bargaining power with doctors and hospitals, and you'll have more doctors. Unfortunately, if you look at research, when you look at the various healthcare mergers that have occurred in the past, those costs rarely flow to the consumer.
Okay, so jury out there. But if you're a shareholder of one of these companies, what can they expect?
Well, in anticipation of the Affordable Care Act passing through the Supreme Court, these stock prices of the companies have gone up tremendously, 30 to 50% over the last year. Compare that with a 3 or 4% rise in the stock market, and you can see that investors kind of figured out where the savings is going. That is flowing to the shareholders.
Jill Schlesinger, thank you.
Thank you.